Welcome everybody. We are now in week 5, so we've got 2 more weeks left of the class, and this week we're going to be covering modules 10 and 11, so you'll only have 2 modules for this week, and both of the modules will deal with pain. So module 10 will be looking at the nature and the symptoms of pain, and then in module 11 we'll be looking at how to treat pain. So for chapter 11, the nature and symptoms of pain, let's look at the objectives. We see that we have first to get familiar with what is meant by pain. So understanding the qualities and dimensions of pain, because not all pain is created equal. So we'll be taking a look at the various types of pain and how even similar pain can be felt differently or described differently, and that we get much information about where a pain is located or how exactly a person is experiencing pain by their descriptions of it. We'll be taking a look at organic versus psychogenic pain, basically tissue damage versus more of the neural types of pain. And then as well, acute versus chronic pain. We have some pain that's very short term but can be very intense, like a good example would be childbirth. Is thought to be one of the most painful things a person can experience, but it's acute because the duration is short. Versus chronic pain can be a pain that could be very severe or not very severe, but last a very long time. So it's important to think about when we're talking about pain, acute versus chronic doesn't necessarily refer to how bad the pain is, severity of the pain, or how it's felt. It's more dealing with the duration of the pain. And we're going to spend a lot more time in chronic pain than we will in acute pain, mainly because chronic pain is one of the most debilitating illnesses that people can have today. It is one of the top reasons for missed work or workers' comp, being out of work. It is also comorbid with some of the huge killers today. Some of the biggest pain experts are people who are working in fields like cardiac pain or rehabilitation for people who have had a heart disease or have had a heart attack, pain associated with diabetes, HIV and AIDS. Back pain is the most common type of pain, joint pain, arthritis. So we have, a whole host of various illnesses existing that people are either undergoing pain treatment or pain management for, or are seeking help for. So we'll be looking at chronic pain a lot. We'll also be talking about the physiology of the pain perception, like how exactly is pain felt from a physiological standpoint, as well as some of the early theories about pain and how we experience pain. We'll be taking a look specifically at the gate control theory of pain and the neuromatrix theory of pain. Both are very relevant and are what we use today to understand our pain experience, but each just explains it a little differently, and it depends on types of pain too that we would be experiencing. We'll start to integrate some of the past work we've done when we looked at drugs and behavior, and we'll be taking a look at how actually opiates and opioids can work in pain management and how we've seen them used. So you'll be hearkening back to chapter 7 where we were looking at some of those issues. We'll also look a little bit more at the sociological perspective of pain. So how learning is involved in the association of pain. We tend to experience pain in the context of many other things going around on around us, and we associate pain with things. And this can help us and it can hurt us. So there's very much a social process involved when we talk about pain. And some of the sociocultural factors would be things like gender, culture, age, socioeconomic status. All of those factors or variables can affect how we experience pain. They can play a role in our pain perception. So we'll be taking a look at that. Another big piece is coping. How do people cope with pain? And that touches a little bit on treatment. So we'll touch on it here, but we'll get into it even more so in chapter 12. Then we'll take a little bit of time and look at how pain is measured. I've actually included a scale down here for you. It's the McGill Pain Scale. You don't have to do anything with this. You're not asked to turn it in, but I wanted to provide it because it's one of the most widely used scales for self-report or an individual reporting on their pain. And many of you may have seen this before, actually. If you've ever been in the hospital or been in an acute type of pain or chronic type of pain, you may have been asked to fill out a pain scale so that a doctor could get a better gauge of the pain that you're experiencing in order to better treat it and isolate it or recognize it or understand what your pain was doing. So we'll take a look at some different measures of how pain is assessed. That will include the McGill Pain Scale, but others as well. We'll look at the pros and cons. There's many ways we can gauge how much pain a person is in, and maybe how that pain is limiting day-to-day living or activities that the person is used to doing. They range in scope from self-report measures of, I'm reporting on my pain, like the McGill Pain Scale, to behavioral measures like watching what a person is doing. How are they limited? What were they doing before they were in pain versus what are they doing now? What is their body doing? How are they responding? What might their facial expressions be showing, or their posture can often indicate pain. We tend to baby a pain area. So for example, if your knee is hurting, you might limp a little bit or walk a little differently. That would be a behavioral measure of pain, something we could actually see in a person's behavior. And then psychophysiological measures might be, how a person's body is responding to the level of pain. Is their heart racing? Are they sweating? And how is it affecting their physiology as well as their psychology? Are they under a degree of depression or anxiety due to the pain? So combined, really, these are all great measures, and we often see them used in tandem with one another. We'll take a look also at some special considerations in pain, especially with young children and adolescents. And this involves their sensory and cognitive development, because if we think about children, they're still developing, and pain can thwart that or affect that differently. Their experience of pain is often reported very differently than that of an adult. And children are often undertreated. And the main reason being they don't always know how to express pain, show it, what to do with it, whereas adults tend to be much more verbal in their pain assessments. And so that will wrap up the chapter. The discussion for this week has to do with level of religiosity or lack thereof, and its impact on health. So the readings in the Longevity Project will be taking a look at the termites and what their religious involvement was like. They'll define what that meant, because today religious involvement can mean many, many things. But we'll take a look at what that meant for the termites. How did they assess it? How did they define it? And then ultimately, what did it show? How did religion factor into the health and longevity of the Terman participants. And the interesting thing I kind of want you guys thinking about is, how did their habits and their practices when it came to religion associate with their health? And we're going to see a lot of positive associations. Okay, that's the big kind of key hint there. And how does that relate to today? People aren't necessarily less religious today. I think that's a fallacy. We tend to think that maybe people are less religious today, but it's actually not true. If you look at the numbers of faith believing people versus non-faith believing people, we see that many in the majority still are, but our habits and our practices have changed. For instance, you may consider yourself a religious person, but you may not ever go to church, or you may not ever read a religious text, or participate in any religious events or programs, and that's very different from before. So 50 years ago, if you were religious, it meant certain things, you did certain things. So bringing it back to kind of psychology and a lot of what we've been talking about, it affected your behavior. Anytime you're doing certain things regularly, it's going to affect your behavior and then your health. Okay, so it'd be interesting to see what you all thought of that this week. You're going to be doing the assessment again, and I want you kind of thinking not necessarily about your overall score that you get on this assessment, but how you got that score. So depending upon how you answered certain items, how might this affect your overall health and positive outcomes in life? Okay, and I'll just leave it at that because I don't want to give too much away, but definitely you'll see what I'm talking about when you fill out that assessment. So just like normal, you're going to fill out the assessment, you're going to say what your score was and what that means. You're going to be answering these questions. And I do just want to remind everybody that you are responding to 3 other people's posts. I just noticed a few of you tend to not do that each week, and that really does hurt your grade overall. The original posts are worth 10 points, and each response to another person is worth 5 points. So not doing them is gonna hurt your score. Another question that I've gotten from a couple people is, how do I shoot for that 25 out of 25? And really, I would say a lot of you are doing a fantastic job. The more that you can integrate in the readings, both from the Serafino and Smith book and from the Longevity Project, the better. Okay, I love to see overlap. I love to see you making connections in the material and bridging concepts, because oftentimes the 2 texts go right along with one another, and they're supposed to. That's sort of how I've designed the class. So even though, for example, this week the Longevity Project is talking about religion and the main text is talking about pain, I'm just going to throw out a little tidbit. How might religious practices affect someone who's experiencing pain? Could it help? Would it hinder? What might that be like? Is there anything that we can take with us from religion, and not a specific type of religion, but just religion overall, that might help us in our pain symptoms and even pain management? And you're going to see how actually the answer to that is yes. In the next module, we're going to see actually a doctor who's taking principles from Buddhism of meditation and uses it to his advantage with his patients to get them to experience less pain. And so it's just a really cool thing, and it's a way to bridge what you're reading in the Longevity Project with what's being talked about in the main text. So the more that you can be doing that, the better. And you should be doing that in your responses to other people as well as your main post response. And that's really going to do you well there. And then just make sure that you're always citing your sources, of course, and doing so properly. Okay, and that just wraps up Module 10.